Well, welcome everybody. No, I am not Amy Duncan, so we can start out by that. You were probably expecting to see Amy today. She sends her regrets. Unfortunately, she wasn't feeling well, so she is not going to be here tonight. I will try to do more than an adequate replacement. I know a few of you that are actually on this call today, and I will go through kind of a background, a little bit about the Brink. I always like to say I apologize for those who are first time involved, looking at being part of the San Diego Angel Conference, and because those who've been here already, I'm going to be a little redundant for them. Just a quick thing before I get started, since you know nothing about me, the relevance of to me to the San Diego Angel Conference is that I have been involved in six, I think we're on seven if I'm correct, six out of the seven San Diego Angel Conferences in various capacities. And they've gone from literally as a angel investor in my first one, learning, to running the Angel Boot Camp last year for 2 days. So, and I'm a very active investor. I invested in like 140 companies in the last 5 years. So, I've talked to many founders and I dealt with 70 clients last year, and I invest in a broad variety of companies from life science to fintech to platform companies. So, that being said, before we get started, those who I can see, I just want to make sure everybody can hear properly, always. So is the thumbs up? Can I get thumbs up for everybody? Okay. And there'll be, if you haven't been through this before, I'll go over the agenda, but basically we have two people which I'll introduce who will be speaking tonight. And in addition to that, we'll have opportunities for Q&A. And I will be admitting new people. Sorry, there's a couple new people coming that I'm clicking on. Welcome those who are just arriving. So I'm going to start there. And before we get started, is there any like just in terms of operationally questions, if you have right now, I would just put them in the chat. And that way I have someone there, Stephen is there, and he will help us as we go along. So if there's anything operationally, if there's a problem, you can't see our slides or whatever it is, please jump in. As a reminder, and I know Stephen put this in, we are recording this, okay, for this evening, and it will be available to all of the people who have registered for this. So this is part of the weekly series. And again, for those who like and see their hands, how many people have attended some of these other events? Can you just like put your fingers up if you've attended any of these other events so I get a feel? Okay, a bunch of you. Okay, good. So I'm going to talk a little bit about, well, first I'm sorry, I want to talk about the people who are going to be actually presenting. And when they do their presentation, I'm going to let them kind of give you their own intros, but we're very happy to have both of them here today. And they have different expertises. And I think you'll find, some of the kind of issues that you're going to have as founders, I think you'll begin to relate with what some of the experiences they have. So I'm not going to go in deep on that at this point, but you'll hear from them shortly. The partners, we always talk about, Amy always talks about this, and I always talk about this. A lot of these people are part of our ecosystem. I am assuming most of you are from or part of the San Diego ecosystem to some degree. And so I just want to make a couple of points here. Part of the beauty of the San Diego Angel Conference is it's kind of a launch pad, not just for a lot of founders, but for angel investors. And you as founders, I always say as an advisor that you need to learn the ecosystem. So when you look at these names on this sheet, I know many of them you may know, but many of them you probably don't. And depending on the space that you're in, you want to get to know them. I'm going to give you an example. Like, for instance, Aquilius tomorrow is having this event at their facility, and they're essentially an incubator. They actually are creating a fund now, and some of you are going to have to raise capital. So if you're in sort of the life science biotech space, they're great people to know. They're out in Rancho Bernardo, and I'm happy to send people, if they send me a message, I'm happy to send you information about tomorrow's afternoon and evening event. It's primarily designed around women tomorrow, but men are invited. It's not like you can't go. All right, it's women founders. New fund. Last night we had a big event with 100 and something people. That's another fund that you might be interested in. So there's a lot of people in here beyond just the beautiful logos that we show that you should think about as founders as you proceed in the San Diego Angel Conference. And there's also as you just decide you want to raise capital or you want to get expert help. We don't exist, meaning the Brink wouldn't exist without funders. And I know it's been rather controversial lately in terms of money coming to organizations like us, but so far it seems to be okay. I'm here. All right. And I do this, just understand this is a part-time, for most of it, it's a part-time gig. So like, and the advisors in the Brink spend anywhere from 10 hours a month to 60 hours a month, most of them, all right, helping companies like yours to be able to raise capital, to build strategies out, to learn about how to go to market, et cetera, et cetera. But without the help of the grant funders, we wouldn't be here. This is more about the ecosystem. Again, this slides will be available to, but this is just like, it's a big ecosystem here. So we have, sort of a process. A lot of people start out, like many of you, working with the San Diego Angel Conference. And then I can give you example where they went through the Angel Conference, maybe they ended up getting to the finals, maybe they didn't, but then they went on to work with other organizations. Maybe they went over to raise money via New Fund, or maybe they went to Techstars, or maybe they went to Stella, where they help a lot of the women founders. Or maybe they were working simultaneously with SCORE. So there's nothing here that's like exclusive. It's not like you just do San Diego Angel Conference and you're done, okay? You go to the place that's most appropriate in terms of your company and your needs. But my point also here is we have a huge ecosystem. If you're new to our ecosystem, you'd be surprised the thousands of people that are involved in supporting founders like yourself, either with financial support and or with advisory support and with expertise that's very, very relevant. So agenda tonight, we're going to have I guess I'm doing the intro right now. Laurel Nelson's going to talk about the go-to-market. Maria Gonzalez-Blanch is going to talk about business models, and both are really, really important because fundamentally, if you don't figure these two things out, and when you're in your due diligence, whether it's San Diego Angel Conference pitch or whether it's actually raising, capital with an individual investor or fund, you're not going to get very far. And we're going to have some closing remarks and Q&A as we go. The intro right now I'm going to talk about is basically how we work, what's the Brink, what is the pitch prep to help you, and I'll try to go through that relatively fast because I have a feeling some of you have been through this part of it before with Amy. So the Brink, quickly, and I'll try to give you a quick overview. SBDC, there are 6 centers in San Diego. There's roughly 100 advisors. Each group kind of specializes in a different space. Primarily companies that are looking to scale, looking to grow their businesses. Very often they end up coming to the Brink. And it's free, as you know, I think already. It's a free service. It's a phenomenal service that last year, when you look at the whole SBDC, we actually, all of our companies raised $300 million in San Diego. So it really is a real asset to help people get to the next step. It's also getting in the ecosystem. Like all of the people that I work with at the Brink, they're either fellow investors or they are people who are sitting as executives or founders of previous companies. We have some legal people give you advice and patent advice, and they also know the right people depending on what you're building to help talk to. The San Diego Angel Conference, I think you know already, it's a pitch competition. By the way, is anyone I can't see everybody on the screen, but can you put your thumbs down if you don't know what SDAC is, and put your thumbs up if you know what SDAC is? Give me an up. Okay, anybody a down? Okay, all right, cool. So that's a good start. So I won't go too deep, but I'm going to quickly just tell you, I'm just going to tell everybody, since I've been deeply involved and I've sat on due diligence things, I just want to explain kind of basically how it works. You guys are going to go and put all of your data rooms and information in your videos up on, Gust, and you've probably had some advice already. I think there were already sessions on some of this. And in that, whatever 2 minutes or whatever time the people who are judging you, and they are judging you at that point, they're going to decide, do you go to the next round? And so the question is, you got to make sure that your video is really good. You got to make sure that your solution is clear, and that things like your problem and your solution and benefits are within a few seconds, that people can figure it out. All right. And I'm sure most of you have advisors already. So you're probably hearing some of this, and I'm sure you've heard some of this in other presentations, but I want you to think about it. Then there'll be a bunch of accredited investors. There'll be 30 to probably 50 accredited investors. They'll create a fund. Depending on what they put into the fund, there'll be anywhere from one to, there's been as many as I think 4 winners, I'll call them, people who got capital. And it's been as little as like 75,000 up to 200 and something thousand for at the end of the competition. But the real benefit of this is that you learn how to pitch, you learn how to present, you learn how to do a Q&A, you get better at your craft, you build a better company in what you're doing. And many of you, I'm told, actually are beyond at least napkin stage, all right? And I know there may be a few that aren't, and there's nothing wrong with that, but many of you are at the point where you've thought through the business, you have a team or some sort of team put together, and that's great. That will help you get to the next step. The training, I'm sure all of you are familiar with. There's a bunch of different training. You try to attend as many as you can. I know the ones that are virtual are being made available to you online if you can't make it. These are some of the timing dates. The reality is you got to sign up by February 27th. I think that's the real date. I want to make sure everybody knows, because anyone who was involved with SDAC, we tend to be a little loose on that date. I don't think this year it's going to be so loose from what I'm hearing. So 2/27, if you haven't signed up for SDAC yet, make sure you sign up. It's, I think, $49. There's not a huge cost to it, but sign up and then work with an advisor or look at all the information that's in this training so that you do GUST properly. All right. There's a whole bunch of information that needs to go into it that you want to use. And then the process will go all the way to June. And there'll be a full-on due diligence, a thorough due diligence that will go on through June. The Brink is involved, and it's really, we'll help you practice your pitches. There's, like I said, I don't know, what is there now? 13, I think. We just added a few new advisors. So there's 13 advisors. There's ample enough advisors over the next couple of months to help you through your process. Kathy Pucha, has been with San Diego State University for a long time. She's transitioning literally what we used to do at USD to San Diego State, but it's a great competition, and you should all participate and get into the SDSU ecosystem. The portal's open. My suggestion is, again, if you haven't registered, use that link. Either you can click on it or scan the QR code, and the next one will be the pitch deconstruction. I want to make this point. It gives you a chance to practice your pitch. And one of the things that everyone should be doing is real time practicing your pitch. Now, if you're not ready to do the 1 minute or the 3-minute pitch, don't do it. But talk to an advisor, get some feedback, and you'll get a number of, usually angel investors will show up to this February 26th. Some other advisors will show up, and they'll give you an honest critique to help you do it. So I'm not going to go through all this just to save time here, but basically you have this in the slide. Again, many of you, I suspect, have seen this already, but it's basically the deconstruction of the 1-minute pitch. I'm happy, and the other advisors are happy to help you one-on-one to go through this if you don't understand this. There's the link for registering for advising if you don't have it. Again, any of us either put it in text. I see Stevens put some information in there too on the application, the chat window. Follow us, of course, on the Brink. There's always events going on. There's all kinds of training, and it's not just SDAC event that you're going to. We are year-round helping, people who are trying to start their companies. So, and I think that is it for my initial pitch. And if my slide will change, which it won't, I guess we're going to move on to our guests here. And so my question is, I don't know which one's going. I think Laurel, I think you're going first. So why don't you go ahead and share? Laurel Nelson is going to do our own intro. I apologize because I didn't have the intro standing in at the last moment. But we appreciate her coming, and she is she's kind enough at the late hour of where she's located at the moment to join us. So thank you, Laurel, and I'll turn it over to you, and your screen should pop up in just a second here. Can everybody see Laurel's presentation? Okay, thumbs up, and thumbs up that you can hear when she starts talking.
And can you hear me, everyone? Good. Well, it's super nice to meet you. I've known Amy for almost 20 years. We've worked together professionally and then have been friends and have worked together as consultants. So I'm super excited to be here at her invitation. What I'm going to go through is going to be a lot of content, try to keep it high level, but there's a lot of detail. And it's not only for you to put into your pitch deck. It's way too much actually to put into your pitch deck, but it's really to give you a flavor of what it takes to commercialize products once you have the product concept. And the reason this is really important is that you need money to do it, but you actually have to execute very seamlessly in order to get to market. And so please take this context as kind of future advice and things to think about as you move forward on the commercialization processes. So my name is Laurel. I've been in the clinical diagnostic and life science industry for over 25 years, as have my husband. So between the two of us, we've pretty much had every lesson learned you can imagine. I've led teams and launched products at Bio-Rad, Applied Biosystems, LifeTech, Luminex, Immucor, more recently at Thermo Fisher Transplant Diagnostics. Several of these products have made enough money to actually sell the company. Luminex sold the company to DiaSorin based on the Ares platform that we had built. And really, I've been on the upstream product management side all the way down to downstream, at least, managing teams in those areas. And I think having a seamless strategy that can go from business planning to product management to marketing communications to regional marketing to sales is really critical. My company is InnovexDx. We launched in August of last year. And really I've gone through several role transitions over the course of time. I have a huge tool bag that I've put together, and I've helped very large companies make a lot of money, kind of, not being the greatest of people and scientists. And so I really wanted to take these tools and work within the startup community to kind of convey my knowledge and expertise to those that really want to make a difference. I'm familiar with the Brink through Amy. I work with the angel investing group out of Houston, at Baylor actually, and I'm starting working with the Georgia Tech incubator Nucleate, as well as Georgia Bio and Portal Innovations to kind of get their programs going as well. All right, so enough about me. Let's talk about how you turn good product ideas into money. So I've been at big companies, medium companies, been working in the startup space for about 8 to 9 months now. And every single company that I've worked for, regardless of size or worked with, thinks that if you have an awesome product idea and a really good sales rep, you will make a ton of money. And unfortunately, there's a whole lot that has to happen in between your product development and your sales process to really be successful in the life science tool space, and especially if you're looking at a clinical diagnostic application. So what we're going to go through today, again, at a high level, there's so much detail that goes into all of this, but we're really going to look at what do you need to do from a preparation and planning perspective around retesting your assumptions in your business case once your product concept is done, really doing planning around not just commercialization scope, but organizational readiness, as well as figuring out how much money you really need to plan and ask for from investors for market access efforts. And then we'll get into how you actually execute and then measure your execution, which is really the most important part, because if you just execute blindly and you don't have those checks and balances in place, you can end up spending a lot of money that eventually doesn't, give you the results that you want. And you have to, go back to the investors to continue to ask for money because you're not generating revenue. So I'll start with retesting assumptions. And I know that Amy had mentioned that you've already gone through the training course on developing, value propositions and product concept and all that good stuff. I think the most important thing, and where I've seen some companies slip up, is that what you have in the beginning is very rarely what you have in the end, whether it's a product configuration or it's a time frame in which you're launching, or sometimes the markets change. I mean, we just alluded to this, right? The funding environment is changing a lot. So you need to take all the good work that you did up front and really test that once you have the product at the time that you want to launch it, to make sure that you don't need to change your approach, your strategy, or your value proposition before you begin to execute on a launch. One of the things that I found in many, many cases that isn't considered when putting together a product concept and a value proposition is what I call the concept of pain of change. And that's just the inertia that it takes to get a customer to actually change what they're doing, whether that's retraining on something or changing the sample collection process. You may have the best solution on earth, but if the customer doesn't value it enough to actually change what they're doing, that can be a huge barrier to sale. So I think that's one area to really test, and this might be an area to get third-party help to do product concept testing and really understand. Customers will always say, yeah, that's great, I'll use that, but are they really going to spend the time to change their processes as well as get the money in order to adopt your product? The other thing is, we're good at identifying all the reasons that someone will want to use the product. I think we need to really also identify, the challenges, the barriers. As I mentioned, software training is a huge one if your product involves software. Do they need to revalidate their systems? Do they have to change the way that they actually collect the samples? Is purchasing going to become a barrier? Are there things outside of the control of your workflow that would have to change in order for the customers to use your product? So it's really important to really understand not only what the good is, but understand the bad. Because if you do, you can put together processes and training and tools to help customers overcome these barriers. So you're not out there kind of, fighting in the field over challenges they may have. So as I mentioned, one of the biggest, I'm going to go through some key failure modes as I go through this talk, and feel free to interrupt me with questions, of course. But one of the biggest failure modes I've seen, companies large and small, is that the assumptions don't change before launch. You go in with a business case, you pitch to your investors, you pitch to your company board, whoever it is, and you say, I'm going to build this in this time frame, and I'm going to make this amount of money. And then you have scope creep, and then you miss your timelines, and the business case isn't updated. So you really need to make sure that you're revisiting your financial expectations every time there's a material change in the product, so that you're very clear with your investors, whether it's, again, your boss, your board, angel investors, about what to expect when you actually go out the door. Another thing to test and build out is really the customer personas, and making sure you've been very specific about identifying who's going to purchase your product, and that you really understand them on a personal level before you think about even putting together some marketing material. So not just understanding who they are, what they do, and what the barriers to sale are, but what drives them professionally, who's influencing their decision makers. You may think you need a website, but really you need a KOL team really to influence them. So kind of a marketing 101, place to start once you've kind of revisited your business case and revisited your value proposition, to start to build out the customer personas as well as the message maps. And the reason I have this so upfront in the presentation is because if you do this all upfront and it's very clear, everything you do then, whether it's a sales training or an event or a piece of collateral, everything should tie back to these key sets of messages that you've tested with your customers to make sure that they resonate, that they bring value, and that they're uniquely differentiated before you spend any time and money actually developing a lot of the content. Lastly, one thing that I've noticed over the course of time is that a lot of companies come up with what they think is awesome value prop and awesome positioning, but when you look at their competitors, it's all the same. Like when I was at Life Tech, everything from every company was for life. It was literally the exact same copy. And so, really consider where you play in the competitive environment. And there's this concept that I put together called a competitive value map, where you can basically map what are the most important things to your customer. How do you satisfy your customer in these areas? And is there something, maybe it's not the most important thing to your customer, but it's something that you do really, really well that you can really build out as the, the key pillar of your competitive positioning. So in a nutshell, validate your value proposition, be clear on your messaging, get that documented, and then make sure that it's competitive at the end of the day so you truly have a unique value proposition. And lastly, don't leave brand to the last minute. Brand is really the customer experience and what the customer thinks about you as a company. And so it starts from the minute you start messaging, the minute you start selling, the minute you start doing anything. And the more streamlined you can be in your brand development and how you execute and be proactive and plan this up front, the more effective you'll be. There's some great kind of downstream, it's not my area, but downstream brand development and website development consultants that are out there that can help. My favorite is Bino Rhino. We work together all the time. But this is really something that you should put as much thought into as you do the technical features of the product and your customer positioning, as well as your value propositions. Okay, so that's all kind of the qualitative marketing planning that you would do before you start really building out marketing campaigns. There's some true organizational things that you need to do also in order to plan your resources and your approach and your budget to go to market. And this is big failure mode number 2 that I see is very small companies will want to do as much stuff as all the big companies that they've worked at, or sometimes everyone is so excited and enthusiastic that they stick in brainstorming mode and they can never actually get a plan together to execute, and then they end up spinning. So it's really important to understand what your end goal is. Think about execution excellence, but really understand what your restraints are, especially as small startups. There may be a billion things that you want to do, but you have to identify the critical elements that will make you successful in market, and then you need to stick to that plan. I've seen a lot of startups kind of burn through cash pivoting and changing decisions, and maybe they haven't really thought through how to get to market, and so they end up having to change the way they're doing things, and that gets pretty ugly from an investment standpoint. It gets pretty ugly when you're at bigger companies too, if you keep changing your plan and asking for more money. So I'd say set a plan, measure it, and stick to it. Unless your measurement process is telling you that it's not working, then you should definitely have a meeting with your stakeholders and figure out what to do differently. And then as you put together your budgets and input to set realistic revenue goals, this is another thing that I've seen companies big and small have very aspirational views on revenue. They end up missing big time. So this is a good place to bring in people that have launched products in different areas over and over, just to get, because the thing that investors want is they really want to trust you and know that you're what you're doing and that you've scoped it and that you'll meet your goals. And so this is a really big one that that you need to get right. Detailed commercialization planning. I actually have a checklist I built over the course of my career with input from others and help, of course. It currently has 165 line items, both for products as well as laboratory services that could be done for a launch, but probably not everything should be done or realistically could be done. So start big with your vision, refine to a must-have and nice-to-have, clearly identify out of scope. Scope creep, as I mentioned, is one of the biggest failure points that I've noticed. And then make sure you understand the budget that realistically is needed to execute on these items over the course of time, because you will need funding to bring your products to market. Also, organizational readiness. It's challenging with small teams because you wear a lot of hats, and I think it's even more important with small teams to be crystal clear about roles, responsibilities, and where the team should collaborate. I personally have found RACI matrices very helpful. They're not exciting, they're boring to put together, but they help teams know where to focus. You need to know where you have internal skill set and where you need to bring in consultants potentially from the outside. And then also, spend a little bit of the time and money to make sure people are trained in their roles. My background is primarily product management, and many of the product management groups that I have kind of ended up managing over the course of time were tech support people, supply chain, very smart people, R&D chemists, very smart people, but they were never actually formally trained in product management, so they didn't know kind of how they fit within the organization. I think it does benefit you, even though there's a small cost up front, to get your team members formally trained in whatever role or roles that they're supposed to be performing in. And then I can't message this enough. I have worked with companies of 5 people where nobody talks to each other and balls are dropped all over the place. And I've worked at huge companies where the communication is very streamlined and they can make decisions effectively. So set expectations around communication, take meeting minutes, send out meeting notes, leverage Google Workspace, leverage Teams, leverage all these technology tools that we have to make sure that you're not spending time rehashing decisions or communicating things that people should know, because you have to act very quickly and make the best use of your funding. And so communication is something that takes active management and a lot of strategic thought really to get right. Failure mode number 3 here that I see. You see it in big, bold letters. I can't tell you how many times an R&D group has said that their product is ready to launch because the data looks good. And when they either transfer it to manufacturing, or they set it up in a customer lab for a clinical trial, or they set it up at a single site testing lab to run as an LDT, and suddenly the assay doesn't work at all. This has happened at, again, companies large and small, not pointing fingers at anyone, but one of the most important things you need to do is make sure that the product that you've made can be built in manufacturing if that's your strategy, or run in an external lab if that's your strategy, and validate that early on before you put a lot of effort into any sort of marketing or commercialization efforts. Because if you don't have confidence that your assay will perform and produce the results that you need, you don't need a website, you don't need brochures, you don't need KOLs, you don't need market access, you don't need all this stuff. So I'm just gonna to stress that, as much as possible. Also, even as small companies, it's important to really make sure that you have purchasing contracts in place for your critical components. One company I was at about a decade ago, they were just buying stuff off the shelf from QIAGEN to put into their diagnostic products. Well, QIAGEN doesn't do lot control and lot to lot consistency tracking. And so the performance of the assay, which was an IVD through the FDA, would change every time QIAGEN made a new polymerase. So, obviously that caused a lot of issues and a lot of customer heartburn.
Hey, Laura.
Yes. Mm-hmm.
What do you mean by do not buy off the shelf?
So if you're purchasing components to go into an assay, so my specific example is it's PCR-based assay. You need to buy polymerase from a company. If you do that, make sure you have a purchasing contract in place and that you have QC specs so that when you get the polymerase, you're measuring its performance. This company that I was referring to, and this happens all the time, was literally just going to the QIAGEN website and ordering polymerase, taking it and putting it into a product. So they had no way to make QIAGEN adhere to any sort of performance standards. And because polymerases are enzymes, there's a lot of variability. So every time they got a new, vial of polymerase from QIAGEN, their assay performance needed to be completely reoptimized. So that's what I mean by off the shelf.
So if I buy from Best Buy or Home Depot and just change my software, it is an off the shelf. There is no issue with that, is there?
Software's a little different. I'm focusing much more on biologicals than anything else. But if
Got
you're,
it.
yeah,
Thank you.
If you're reprogramming software, then you're still owning the the final version.
Yeah.
And can I just quickly jump in there, Laurel, on the software issue? We'll save this kind of question at the end when you have, because other industries, there are supply chain issues, there's traceability issues, there's the quality of the stack. I mean, there's a whole bunch of other issues that start early and can cause you lots of problems downstream. So we'll try to answer some of those questions as we get to the end.
Yeah, that would be helpful. I'll admit that most of the software I work with has been coded internally, so the expertise is different in the world of AI now. So open to feedback there. But to your point, ensuring you have a manufacturing QC process in place, whether it's software or instruments or biological components, making sure that you're doing the basics as far as tracking, because when you have a problem, you need to be able to go back to that component that's causing the problem. And there will always be problems. So it's really important to make sure that you're tracking all this information. One of the other things I've seen with product launches, and again, you're a small organization, so you probably don't have all these different companies, but you probably have people that are wearing these hats, is launch is a company-wide effort. It's not just marketing going out to sales. You need to make sure that everyone's trained on the product, the ordering process, how they, bill for the product can come up sometimes. And then even from a management and leadership perspective, again, as startups, I'm assuming the founders and leaders are very involved, but I have been at companies where products have launched and the leadership doesn't even really know the value proposition, the target customer, what to say. And they get interviewed by investors, by PR, they go to events. So my message here is really training should be holistic, and every single person in your company should know exactly what's happening, exactly how to message, and exactly what to say if they get questions from customers or investors or anybody else, and just be on the same page. Early access testing is another area that's often skipped because everyone wants to just push to make revenue. But it's really important, even if it's at a small scale, to make sure that you've tested your manufacturing processes, your fulfillment, and your installation before a full launch in exactly the way that you would do a full launch. So I'm actually working with a company right now that's doing a pilot, and they're learning a ton. And it's a good thing that we're doing the pilot and not just launching to everybody. Because again, like I said, there's always going to be things that you don't think about. And this will enable you to make sure the product quality is there, it's reproducible at a customer site, your shipping process is well fleshed out, and then you can integrate any lessons learned into your full launch. So it takes a little bit of time, and it can be revenue generating, but not at a large scale. But it's important to do, because especially if you're new and you're trying to build that brand reputation, if you hiccup along the way or you dissatisfy customers, that can be, pretty bad going out of the gate. So it's important to make sure that your customers are happy. Okay, so that's all the prep and planning. We'll go into more of the marketing stuff now, really, truly the messaging, what you do with the messaging, since you've already kind of aligned on the message maps, but what kind of tactics, campaigns, and activities really will help prep the market to drive demand for your product. One thing that's really important is data. You can call it proof sources, whatever you like. Make sure that you have external publications, not just internal publications. You need we're all scientists at the end of the day. And so we scrutinize everything, and customers will want to know that your product does what you say it does for people that don't, work at your company. So external publications are very critical. But with that said, you also really need to think about summarizing those publications into digestible sources of content. Just sending a customer 10 things to read from, 10 papers from Nature or 10 papers from whatever to read, that's overwhelming, and it takes a lot of time. And everybody kind of has their different area of expertise. And when I was in leading transplant marketing for a company here in Atlanta, we had some really great papers that showed our competitive differentiation, but they were so technical that even our PhD level lab directors didn't really understand the way they were written. So my recommendation is to take all these great publications and summarize them into digestible content that pulls the data into supporting your value proposition in a very, very clear way. So white papers are nice. They more or less have a look and feel of journal articles, but kind of summarize, statements from different journals. Publication summaries, infographics are fantastic. And then you can pull all of this into your social media feed. So you're giving your customers credible scientific data to support that your product does what you said it does, but in a way that takes them like 2 seconds to understand versus having to sit down and read a paper. Another thing that we found over the course of time, every company I've worked for, is that You can have the best website and the best brochure, but it just doesn't matter. What you need is you need peer references and KOLs. You need people in the scientific community who are the peers of your customers to say, this is the best thing that I've used. It solves my problems. It benefits my patients. It enables me to publish. It enables me to further my career and get grant funding for my lab. That's really what they need. They need that credibility. So leverage your early access customers to be, on webinars for you, talking about how fantastic, how, life-changing your product has made their laboratory. Get regular feedback as you go through the launch process from customer advisory boards so that you can, continue to make decisions and keep the customer first. That's one thing I didn't put in here, but always keep your customer first, always get feedback, always understand what they're thinking, always understand what their experience is using the product. If you're going to conferences and events, get your customer to talk. Don't get your R&D lead to talk. The customers they have so much more credibility representing you. You can even have your customers sell to other customers at small mixers. So you can do webinars or very small private events where you bring in your existing customers and talk to your prospects and just have questions and lead the conversation. But the more you can build that sort of outside in credibility within the market, the more credibility that you will build for your product. Speaking of conferences and events, conferences are extremely expensive, extremely expensive. They will be your biggest cost in addition to market access. And many corporate folks have been around for a long time really question even the value of conferences. So, or events, exhibiting, not going. It's important to go from a scientific perspective. But what I would say is identify the conferences that you think will give you access to your target market and go to those conferences first and try to network as much as possible, get a feel for how they're set up. If you really want to exhibit, plan for that. I've actually found, so the AACRs of the world or the ASCOs of the world, you'll be out hundreds of thousands of dollars. What I've actually found is that the small local conferences can be much more effective. They're cheaper, first of all, but secondly, you get much more intimate access to a group of customers. It's not this big, overwhelming event. So I think that you really need to think through your event strategy very carefully. If you're a brand new product and nobody knows your company or knows your product, you absolutely have to go to these events. But I think you can be very strategic in where you go and how you approach it so that you get the maximum exposure for the least cost. And as we move on to actually we're going to talk a little bit here about developing the actual, marketing content and tactics. Similar to the early access testing, it will be really important as you build up your customer advisory boards and these relationships that I just talked about to test your marketing content with them to make sure that it's effective, that it's meaningful. Even before you go to market, you can have marketing content out there to help drive demand and buzz in the market. You have to label it appropriately. If the product isn't launched yet, you can do that. But don't just push stuff out there. I think that's the most important thing, is to understand that based on who you're talking to, what you're talking about, to make sure you get feedback before you spend a lot of money and effort pushing materials out to the market, whether it's doing an event, doing a website, making a brochure. Time is money, money is money. Make sure that you're getting the feedback and you're partnering with your customers along the way. All right, this is the most expensive one. And this is really more for the diagnostic side of the equation, although I think the theory applies in the life science space. But if you're truly looking at a clinical diagnostic product, there's a lot of barriers. And there's consultants that are not myself that focus specifically in each and every single one of these areas because they're very important. And if you are a diagnostic or you want to use any of these tactics to get to market, this is 100% an area that you're going to need to get budget from your investors and your stakeholders. There's a lot that's needed to introduce, gain adoption, and ensure customers can actually pay for the product. So obviously you have to go through FDA or set up an LDT strategy, which is very, very popular these days. Health economics are expensive studies that you need to do in order to get reimbursement. So basically you show that by using product X, it saves money because a patient isn't in the hospital for 2 weeks. They're only in the hospital for 2 days. Or if you use product X, you don't have to use X, Z, Y, and A. So there has to be a math equation that shows the payers that using your product is going to ultimately save them money along the way. Government reimbursement is a whole nother process that takes years. One thing that a lot of companies don't think about is actually getting integrated into the clinical guidelines. So, physicians are very risk averse, as are laboratories, and they will use the existing clinical guidelines, even if they recommend doing things that are not as beneficial to the patient as what you may be putting together. So once you have your regulatory status, your health economics, all your, clinical utility data, you have to work with the different societies. Each disease area typically has a society that it's involved in to really get integrated into the clinical guidelines. Now, the good thing is once you have FDA status, go ahead.
Yeah, quick question. Two-part question. Does this apply to interventions or mainly diagnostics, or both diagnostics and interventions?
What do you mean by interventions?
Like diagnosis tells you what the patient is suffering from, but intervention is a drug or a device that you need to give so that the patient goes from disease state to something better.
It applies to both. Anything in the healthcare field, really.
Thank you. Yeah. And what do you mean by health economics? I have no idea what it means.
Yeah. So health economics, as I mentioned, is they want to see the cost savings to the healthcare system by using your product. So I'll give you an example from the transplant space. Every patient that is transplanted gets immunosuppressive therapy for 3 years. It's expensive, first of all, and secondly, it causes additional damage. So transplant patients can actually get cancer after their transplant because of the immunosuppressive therapies. So if you can provide a transplant, this is why CareDx and Tara and everyone are so successful. If you can provide a test that actually shows whether you're in rejection or not afterwards, you can tailor the immunosuppression. So if you have a patient that, because of their antibody profiles, is not going to reject the organ in the same way another patient is, and you can tailor back their immunosuppressive therapy, not only do you save the healthcare system money by not paying for that therapy, but you also lower the risk of that patient getting an immunosuppressive comorbidity like cancer. And so they look at this big picture equation to say, I will reimburse your product at $3,000 a test because I believe that it will save the healthcare system money in the long term. That's health economics.
Thank you.
Yep. It's complex and long. So even after you go through all these things, then you still have to let physicians and patients know. A lot of the lab products will, their laboratory partners will understand the value of the product and kind of market on their behalf. But if you're looking at, especially like a single site testing lab type service, you need to go to physicians and potentially patients directly. And that can be very expensive too. So, we have to prove the product is worth the pain of change. And this is the company's pain of change here, investing in all these areas. But if you really want to get your product into routine adoption in the diagnostic medical device or therapeutic space, these are some of the critical steps. Within the life sciences tools, you need to help get grant money, you need to educate the labs. It's not as complicated. But again, once you get into these areas, your revenue tends to be pretty sticky. So just going a little bit more into the reimbursement and payer space. So Medicare is usually the first reimbursement that companies seek, and private health insurance typically follows Medicare's example. So Medicare does all like the footwork to make sure that the product is worth reimbursing, and then you can get private insurance. As I mentioned, there's grant strategies and other things for life science tools companies to ensure that the labs can purchase the product. But one thing I just wanted to highlight, which is a kind of a frequent area of confusion, is that if you submit a product to the FDA and you get clearance or approval, All that means is that your product actually tests for the analyte or does what the label says it does. It says nothing about clinical utility, and it says nothing about health economics. Reimbursement only cares about health economics and clinical utility. So just getting FDA clearance is like 0% guarantee that your product is going to be reimbursed. And on the flip side, your product can be reimbursed without going through the FDA if you show health economic data as well as clinical utility. So CMS, the Centers of Medicare Services, is the one really focused on health economics because they control the money. And they're ultimately responsible for making sure that they're within budget from a Medicare perspective. The American Medical Association is the one that's very concerned about, does this product actually improve patient outcomes? So just because you can test for analyte B, does that make a difference when I'm treating the patient? So a good example here is that in companion diagnostics, there's a high degree of evidence that if you test for HER2 new or different genes, that it has a benefit for the patient by taking the right therapy based on that genotype. So you have to generate the data for FDA. Separately, you have to generate data for CMS, and separately, you have to generate data for AMA. So again, it's a lot. And actually, what we've seen in the last few years is that this is so much effort, and these organizations are so hard to influence that there's this whole world of functional medicine that has popped up where it's actually all private pay. And some of it is less expensive than going through the healthcare systems because they don't have to deal with all the administration and the burden and everything of going through like billing and healthcare and all that stuff. So there are companies now that are actually launching with a private pay model, which I think is probably going to see much more and more in the future since these other processes take so long. The pricing strategy, unless you have a truly brand new novel product that's never been on the market before, you should be able to do either a nearest neighbor comparison where you typically do a competitive landscaping on the pricing. You can talk to customers to understand what they're paying, and then based on the value of the additional value bringing to the market, set a price based on whether you want to have a skimming strategy, which is to have a lower volume but a higher margin as you enter the market, or a penetration strategy where you lower your price and to really get market share from the competition. Obviously once the price goes down, it's hard to bring back up. So I don't recommend going in with a penetration strategy unless you do something that's very time bound or for specific customers, like an early access customer, just to kind of get your foot into the market. If you do have a strong health economic argument, you can have a crosswalk strategy, which means if your product saves money from other places in the healthcare system or can be used to replace other products, you can actually increase the price of your product because of the cost savings of the other areas. This is harder to prove, especially if you're selling to a laboratory, because they only see the lab piece of the pie. They don't know what happens in the inpatient part of the hospital or the drugs that the healthcare system is paying for the patient. So typically some tools like cost calculators that can kind of summarize like the before and after can be used with the actual like hospital administration or the the insurance administration that sees sort of the big picture to justify bringing in your product at a higher price. But most products would use a nearest neighbor strategy.
Hey, Laurel, I'm sorry.
Yep.
I just want to, we're getting close to, I don't know how far you have in it, just to leave some time for Q&A. You got a lot of it, so just FYI.
Yep.
There's some questions, and we're getting near our break in a few minutes, so thank you.
Yeah, I'll flip through this stuff. Just failure mode number 5 here. First 2 things I'll just highlight is when you're actually doing your marketing, you need to go through kind of a funnel system. I kind of joke that, if you just have a product and you send an email unknown to a customer or invite them to a webinar, it's kind of like trying to get married on the first date. They don't, they hardly know you, much less to give you time and money. So there's a funnel process that I'll touch on briefly, and I can follow up with anyone that's interested, one-on-one as well. And then when you put together your marketing material, it's good to have data, but don't just present the data. You need to have a story around it so people can digest the marketing material. Otherwise, they get too overwhelmed with the details. So here's, I'll just touch on this briefly because it's actually a longer conversation, but wanted to highlight there's a number of kind of marketing processes, sales process, et cetera, they all come down to the same thing of driving an unknown product into the consideration set and then ultimately being purchased by the customer. But many of these processes that you can find online are linear. In my experience, it's not linear. It's a continuum, because if you actually get a customer to purchase, but then you have bad customer experience, they will leave you. And then you have to put in the effort to bring them back. So as you think about the campaign process that I'll go through in a second, think about this linear cycle. And my most important point is figure out where you are in this cycle to determine what you're going to focus on financially and from a marketing perspective, and exactly what you want your customer to do, because you can't do everything at once. It's not effective. To build upon that, determine where your product is in the product cycle. Determine specifically, when you put together a marketing campaign, what do you want your customer to do? What is the action that you want them to take, and how do you measure it? So if you want to move them from awareness to consideration, think about, okay, I'm going to do a webinar and I'm going to measure the number of people this webinar, or consideration is download content, or trial is to actually order a product. Don't just be like, I'm going to do an email and have some brochures and all this stuff. You need to really kind of specifically move your customers down the funnel and see what actions they're taking to eventually drive them to purchase. Each campaign should have a SMART goal, like you're used to for goals and objectives. And then I'll get to measurement here quickly. I'm almost done, actually. So, but as you do this, as you generate these leads, make sure that you have a process in place. You can use Excel, there's HubSpot, there's Salesforce.com, but a lot of companies don't really track their leads that come out of the marketing efforts or the sales efforts, and then they kind of, end up floundering a little bit. So just wanted to reinforce this to make sure that you have a process around, once you get these customers into the funnel, making sure that you're moving them to close or documenting why they don't want to use your product. And then from a KPI perspective, there's a million things you could measure. You need to really be specific about what you want to measure based on what your campaign is or your sales efforts. Otherwise, you put a lot of effort into managing, KPIs that are interesting, but maybe don't help you make decisions. The KPIs you manage should help you make decisions on your strategy and next steps. The ones I usually look at are campaign performance, specifically channel, so marketing channel versus sales channel, overall company key performance dashboard, and then what is really a future performance indicator to let you know if you're going in the right direction or not. So I'll skip through this, it's available, but campaign should be by phase. Channel should be by your different channels. Often you sell through web as well as direct sales. This is your overall, company. There can be a lot here that you look at. And then Net Promoter Score, NPS, is very, very helpful when it comes to identifying what your sales revenue to do, because it basically measures customer satisfaction, and customers that are not satisfied with you will purchase from someone else. So it's directly tied. Then just to wrap up, what do investors want? Again, this was a lot of content really just to kind of convey my lessons learned as you move forward and run your business. But at the end of the day, the investors, they don't really care about all this detail. What they want to know is, if they give you $1, how much are you going to give them back and when? They want to know that you have a well-vetted, well-scoped, appropriate, and effective plan without surprises and like, oops, we figured this out. Oops, we figured that out. And that you deliver what you deliver. And this is the same in corporate America as it is with investors. You need to know your budget, know your timeline, identify your resources, and be specific with the revenue that you're going to generate. And that's my little picture of a happy investor there. So to wrap up, reevaluate your business case if you go to launch to make sure that you're communicating, accurate and specific information to the investors and setting expectations. Make sure you have an organized plan, not a disorganized all over the place plan on how you commercialize your products. Test your products to make sure they will work in the customer's hands and not just in R&D. The last person you want to be telling you your product doesn't work the way that you think it does is your frustrated customer. And trust me, it happens all the time. And then plan effectively for whatever marketing you want to do so you don't run out of money as you're trying to execute. That can be very frustrating, not only for you, but the people that are executing on your behalf. From a marketing perspective, don't ask to get married on the first date. Take your customer through that funnel that we talked about and make sure you're very specific about how you're engaging them and what you're telling them. And then don't throw an ocean of data at them. Make sure that you're distilling all the good data that you have into a clear value proposition as you're communicating with customers. So I'll wrap it up from there, and happy to take any questions.
Laurel, first of all, thank you very much. That was very, very detailed. And you're going to provide the deck. Is that deck available? Will that deck be available for people?
Most of it, yeah.
Okay. So we'll make sure we provide that to everyone, because I know it was a lot, and some of you who are new founders, that could be pretty intense, especially at the hour. Thank you. The thing I want to say is, first of all, we're going to take 5 minutes, but we can do Q&A. Laurel, if you're going to hang here a little bit, will you hang? Okay. So those who want to take like 5 minutes, actually, yeah, let's give about 5 minutes before we go to Maria. Give you, some people need to get some water, take a break, whatever, and in the meantime, we'll answer a couple of questions here from some people. And Laura, can you see actually the chat? Because there's a couple of questions in the chat that go back. Haraneth actually asked this question. I just got his hand raised too. He wants to know who the customer is. Is it the patient or others I need to convince to use my protocols? And this question came early on.
Okay.
When you were
I didn't see the questions.
So he was just trying to, I guess, understand that. So maybe you could help answer.
It really depends on.
I can paraphrase it a little bit better.
Okay.
Essentially, I'm thinking, who are my customers and who are their customers? If I think of a doctor, it's the patients. If I think of a technician, the technician's customer is the doctor. If I think of a purchaser, pharma, benefits, or whatever, I have no idea where they fit in the chain, but they impact the patient.
Yeah.
So,
yeah, it's a good question. So, your direct customer who's buying your product is most likely a laboratory who also can be influenced by a physician. If a physician's aware of a product, and the physicians are influenced by the patients. And so it really depends on kind of how comes down to the market access question. Many lab tool companies will just market to the lab, but if you're truly introducing something novel that is not available on the market and you need physicians to actually, at the end of the day, physicians have to order products in the diagnostic space. So the lab can't just adopt something. They can adopt your product, but unless the physician is ordering, you're not going to make any revenue. So you have to market to your laboratory, you need to market to your physician, and then ultimately you may choose to market to your patient, especially if you're focusing in a disease area, because they'll knock on the shoulder of their physician and say, hey, have you seen this thing? I think it could really benefit. But it depends on your product, your strategy, and how much money you really want to pay, and then what ultimately is needed to get your product adopted on the market.
Yep.
Okay. Well, we have a question from Pratiksha. Do you want to?
Hi, Bobby. Hi, Laura. So basically, I'm having a med tech, and I liked what you said about health economics and all those FDA and all. So I think I would like to have a one-on-one session with you because I don't want to take the group's time.
Okay.
Because what product we are having is having a huge economic impact. We are in the heart care space, and it can save a lot of money. So I think I'll need a lot of guidance on that. But it was very good. Thank you.
Okay.
Yeah, feel free to reach out. I'm happy to help.
There was a question from Timothy Mackey that said, how to determine conversion last adoption rates, since that will determine revenue?
That's a good question, and a place where a lot of modeling takes place. So it depends on the product. I mean, the nice thing about the diagnostic space is typically there's a certain number of labs, right? You can download the CLIA list of laboratories, and then with your societies, there's a certain number of laboratories that are in that space. I'll typically look at how many competitors are selling the same thing. What is our competitive win rate to know what the number of labs are that are realistic to actually adopt the product, and then look at overall sort of trends in adoption rates, as well as how long it takes. That's the other thing when you do the business modeling and revenue, is that it may take 6 months just to convince a lab that they need to change, and then another 6 months for them to change, and then another 6 months for them to validate the product and actually get volume going. So again, it depends on the product, but there's a lot of different factors you need to look at to understand, what the universe is of customers, and then what that typically there's a sales funnel where you have kind of different sequences of events, and as the customers move through those different sequences, you have a likelihood of actually getting them to adopt. And so you can generate, you say, based on the value proposition, the competitive environment, the price, etc., we believe we're going to get a 15% adoption in 3 years. You can kind of model in that way.
Right, and it also includes how resistant they are to change.
Correct. Yeah.
And how do you put a number on all of those things you just identified?
Yeah, you would need,
because that's what the investors want to know.
Right. I think that's where it's helpful to do realistic product concept, not just product concept, but really pushing on, okay, and you can do forget the name of it, but there's analysis you can do that based on this product concept, how likely are you to actually adopt and actually move forward? So I think you need some market research data there, because it depends on the product too. The pain of change can be so, I was working in the transplant field, and we had these antibody assays, and there are 2 companies that sell them, and quite frankly the quality of both are terrible, but the labs would never change because they have patient histories, 10 years of patient histories for each patient based on these products. So they're handicapped. They can't do anything. They can never switch vendors. So your likelihood to switch is 5% just based on that. But I think that's where you do have to get customer feedback and do some quantitative market analysis to know what those barriers are, to know if it's even realistic to even get a customer to think about changing.
Right. So are you saying you in order to get this information, you really have to you've got to get a customer, at least one start.
Yep. You need to talk to customers.
Obviously.
On that, there's one other question there. Maybe we can just do offline because of time. If you want to take a look at it, Laurel, I don't know, maybe you could answer it. And I think we want to move on.
All right. Job, in my opinion, of capturing a very quality fragrance, putting it at very low price.
Or I think you broke up. I don't know if he was talking to us. All right. So we're gonna move on for a second, and we're gonna have Maria Gonzalez-Blanch talk. I want to mention a couple of things. We're shifting gears completely, I think, in terms of some of the conversation. And I know we have a very mixed group. When it comes to San Diego Angel Conference, we have people who are in lots of different businesses as they go, but everything that Laurel said, many of it, not everything, but conceptually applies to the business. It doesn't necessarily, if you have to get FDA approval, if you have to go through a series of, the economics sometimes are actually different in the model because you're doing discovery, you're getting a lot of non-dilutive money. There's a whole bunch of other things that are unique in some of the companies that, we were kind of leading to. So but the business models, when you start talking about business models apply to everything, okay? And there's commonality. And, Maria Gonzalez-Blanch is going to talk as an experienced investor, as someone who's been involved in some of the groups here in San Diego, like Ad Astra. And I think she'll come with a totally different perspective. And you're gonna have to put the 2 together. I think it's great because remember, everything, when you see the pitch from Laurel and you see the copy of it, I would go back and I would look at it and look at the elements. Don't get confused by the complexity of it. Laurel, you went into amazing detail. And I know that some of the founders are going to appreciate that and go through everything. But for San Diego Angel Conference, sometimes you're going to have to your early stage, you're going to have to use pieces of it. All right. Nobody expects, I want to make sure you understand the expectations. So there's no fear in this audience. Okay. There's no perfection usually at the San Diego Angel Conference. You're going to evolve and you're going to learn more and you're going to apply some of the principles and information that you learned in these previous few weeks and today. So on that note, Maria Gonzalez, I'll turn it over to you. And thank you. Thank you again, Laurel. And there is a couple of questions, I think, there for you.
Okay. Can you guys see my screen?
Yes.
Yeah. Okay. Hello, everyone. Good evening. So good to see everyone. There's some known faces in the audience, so I'm very excited to talk about business models today. Let's make this conversational and informal. Ask any questions as we go, okay? So before we start with a little intro, I just wanted to make a quick remark of how excited I am to talk about this topic today, because right now is more relevant as ever with AI, you know, and all the different trends. Everything is getting disrupted, like even in venture, early stage investing, startup building, things are changing like a lot. And I wanted to, oops, sorry. And I wanted to take a moment to say that, you know, I'm looking forward to this conversation and see the things that I think where are they going and how they're changing. And that includes how we're thinking about business models. So before we get into the conversation, I wanted to take a minute to introduce what we do, because there's some entrepreneurs here I don't know. And we are always looking for new investments. So I thought it was a good time to make a very quick intro. We're in Solana Beach. We've been established since 2012. We focus on early stage, that's seed plus. It's woman-led. Alison and I are the main team, and we have a few other people working with us. We're private. We don't have LPs. We're independent investors. And we're focused on early profitability. This is a quick picture so you get to know us and who we are. We've been investors for a long time. My background is in private equity before I joined Crescent Ridge a little bit over 5 years ago. Alison is the founder, and we're very excited to be part of the community, and we love the ecosystem here in San Diego. So our fund is a little bit different. Some of the advice or my perspective is a little bit biased, just so you know. Most of the venture investors are talking about unicorns and creating, you know, a huge company. We have nothing against unicorns. We think it's great. You know, we have some of them in our portfolio, and they help, of course, but we're not focused on that. On the other side, you have the bootstrap and self-funding and very small businesses. We are not focused on that either. That's not enough for us to make a return. So we offer like a financial solution in the middle between the traditional venture and the bootstrap businesses. And our strategy has been always focused around achieving more reasonable and pragmatic exits or cash flowing and reaching early profitability early. And it's we believe it's a really good approach for the size of our fund and for our skills. So just keep in mind that we have a little bit of a different approach as we talk about business models. This is our focus, Health, People, Planet, and we really want to support founders that are on a mission to create a better world. Very high level, what we're looking for in a founder. Purpose, they're solving a deep problem. And I know some entrepreneurs here that are doing that. So that's very exciting that a lot of you guys are doing this already. And desire to serve others and make a positive impact. Very driven by internal validation and not so much about, you know, the hype of getting like raising a lot of money and building a unicorn and stuff like that. Knowledge and experience. They're experts in a sector or in a problem or in a product. They have a lot of expertise, unique market insight, a strong product market fit, a network of resources related to that problem and that business they're working on. And we love when founders are very business savvy and street smart. And finally, qualities and characteristics: humble, growth mindset, curious, resourceful, pragmatic, capital efficient, self-aware, and a lot of integrity. So very, very high level what we're looking for. We like maximum optionality. We love when businesses are financially independent and they don't depend from venture all the time, profitable, scalable, contributing for a better world. And we love when there's a lot of options. We're not set into an outcome. Some of our companies are very good at getting to profitability early and cash flowing. Some of them end up raising growth equity, and that's great. Some of them sell to private equity or to corporate, etc. This is some of our companies in our portfolio and their outcomes. Again, some of them go to profitability early, growth equity, traditional venture, public markets, sell to corporate, and sell to private equity. So we have a big variety of what our founders decide to do. It depends on who they are and what are their strengths. And we love the idea of getting to profitability early, and that's why I'm very passionate about business models, and I want to talk about it today. So let's get into it. What is a good business model? A business model is, the right business model is very important in the early stage because it's all about survival. Some people will think it's all about pitching and getting investment and all that, but the reality is, like, now more than ever, the capital markets are crazy. You can have the best company in the world and still not fundraise. And we're always optimizing for survival. So because we're focused on survival, we really like, focusing on early revenue, product market fit very early on. And then if you need to grow, that's great, and fundraise, but, start with that. We see that our companies sometimes evolve their business model over time, and we're going to talk about that. But just keep that in mind, that in the early beginning, it's like, how are you going to make money to stay alive? So the question is, how do we design a good business model? Building a good business model, some people say, oh, that's very simple. I'm just going to go and read Harvard cases or whatever and copy somebody, right? And I think it's more an art than a science. Like, yes, there's some fundamentals that are very, you can reproduce them across the board, but I don't think it's a linear process. It's not a one-size-fits-all equation, because it really depends on the action, on the founder, on the strengths, on so many different factors. So it's more an art than a science. That's the point I wanted to make. And something that we are very interested always is thinking about founder market fit. Founder market fit is when a founder's skills and experience align with the needs of the market they're targeting, and this greatly affects the business model in the early stage. I see a lot of entrepreneurs that sometimes are saying, I'm fundraising and I'm building a marketplace or something like that, and then you look at the skills of the founder or, their background, and it is mismatched. So I think everything starts with the founder, who they are, what are their strengths, and then go from there. So this is very high level, like numbers of rule of thumbs of what we look at, right? And depends on the industry, depends on your, everything, right? But investors are always looking at, gross margins. Are they over 50 at least, right? Ideally 70. I love to look at that and say, okay, if they have like very high margins, I love that business. EBITDA margin, same, it's very hard in the beginning because you're not profitable, but this is how the company should end up looking like, ideally, by the time it's a little bit more mature. Of course, not in the first few years, but by the time you want to like sell your company, or you don't want to sell it, you want to keep it, you have to really like look at these elements in to make sure you have a good business. Healthy gross margins, EBITDA margins, ideally over 20. Keep your costs and overhead low CAC, very high LTV CAC ratios, low overhead, etc. Unique value prop, and being very differentiated to the competitors, being in a growing market and having potential to grow, happy, loyal customers, good reviews, high NPS. And then, are you staying on top of the, of your competitive landscape? Are you innovating? How are you adapting to changing market conditions? We love lean teams. I think the leaner you can be, the better. It's always very complicated to manage people, and also a strong purpose and company culture. So winning go-to-market and business model, we always love to say this, create a product that is so good that you don't have to convince anybody, especially in the beginning when you're testing. It has to be a win-win. You have to make enough money, ideally the more the better, so you can fund your growth. And it has to be a no-brainer for your customer. And how do you do this? I mean, there's a lot of testing. We're going to talk about that later, but test. And very high level, like there's a lot of business models, right? This is like a very short list. There's like a gazillion business models out there. There's some that investors prefer. As you probably know, all investors love SaaS. They love razor blade. They love subscription. They love when they can lock in a customer for a long time. The more the better, right? We love this in Green particularly, but I think, again, it depends on what are your strengths, what industry you're in. There's some that we specifically really dislike that are very capital intensive. For example, like marketplaces and some that you need a lot of capital in order to make sense. But the point of this slide is like, there's so many, you don't really have to reinvent the wheel. Although you can, a lot of people innovate in business model and that's enough. But I think like simpler is better. I see a lot of companies pitching that sometimes they say we have a multi-pronged approach to our business model and we have 5 different revenue streams and that's so confusing. I think that's okay in the long term, but in the beginning, the simpler you have it, the better. So, here's a short list of different examples and some of the preferred ones. I just wanted to highlight very quickly that if you end up raising venture, you have to be very aware of what you're doing. And I think that sometimes you end up building your business in order to satisfy the capital, because once you raise venture, you have to provide a return. So that end up affecting a lot of the business models out there. And sometimes you could have a very nice business if you haven't raised any money and go slowly, or it's okay to have one of the other business models that I showed before that are, service-based or whatever. But I think like once you raise venture, unfortunately, you have to really think about, okay, now how much I got like 1 million, now I have to multiply it by 10, so there's no like free lunch. Once you raise capital, you have to figure out in a very creative way how to keep growing and just to be cognizant of that. Here, like very quickly, just some of the business models that I believe are harder. I think anything that requires giving your product for free to a lot of customers, that's going to be very expensive. Like, for example, what OpenAI did, or, freemium models that you give your product for free. Sometimes I like freemium because it's a way to acquire customers in a very effective way. So I think freemium could be a good model, actually. But there's some of these that you just have to be aware that they can take a little bit of your resources as a founder in the early stage, and then you won't see any return unless you fundraise a lot. So I always like to start with something simple that, early adopter that is willing to pay, and then go from there. So this is like a very quick explanation of how we see business models evolving. You always start with your early adopter, and there's some advantages of the early adopters, like they really want you to succeed and they're willing to pay more because they are already looking for you before you're even out there. So in order to satisfy an early adopter requires some things that the early majority or the mainstream people, your business model and your approach to your business might be totally different. And I believe it's a cycle that is always repeated. It always starts with a deep understanding of yourself and the problem, like what am I doing really well? And I can have a particular edge in the market. And then you can go to moving into product market fit and testing with, an MVP and some prototypes. Then after that, you start like tinkering with different business models and pricing and seeing like how you can make more money with less effort. And after that, there's a moment when you're starting to make money, and then you have to figure out, okay, how can I get to break even so I get to financial stability? And after that, I can, get to a place that I can reach profitability, have a couple years of profitability, so then I can go to a bank and, and get some non-dilutive funding. And, and then you scale. So I think like with early adopters, like all these things are very different. And when you get to the next group and the next layer of customers, your market gets bigger, and it gets bigger. Your business model and your approach changes. And especially when you get to the mainstream and you get super big, then you have to, again, change your approach and your product offering and your business model, etc. So this is like just a quick overview of how you have to be constantly iterating, like even as you get to profitability and growth. So this is just a very high level example of some companies in our portfolio to show that business models do evolve over time according to your stage. I chose 3 companies in our portfolio. We have several that could be good examples, but for example, Cooler Heads is a local company. They're awesome. They started, we've been following them for a long time because we invested in the very early stage. In the beginning, before the approval and all that, their assumption was that they were going to go direct to consumer and focus on rental. And they have, assumptions on paper. They made sense, etc. But as they grew, they went through FDA approval. They started to go in B2B and selling their devices B2B. And then they got some recurrent revenue that is really nice. And they're starting to get more and more recurrent revenue from the disposables. So that's great. They started to get move away from direct to consumer, which is very expensive and very difficult. But it's good to start testing, to something that is more stable, recurrent revenue from the disposables. You have more patients that are using your product. So you start to get more revenue, and every month you have a very nice recurrent revenue. And eventually, as they grow, they get reimbursed by Medicare and Medicaid and insurance, and that's even more, that's a beautiful business, right? I mean, once you get reimbursement, it's great. But of course, you cannot start since day one being reimbursed. So this is like some of the examples of how, business evolve. And in the very beginnings, you have to be, doing different things than later on. Arrow is another example in our portfolio. I love this company. They are on a mission to allow families to have less screen time and enjoy their families more and be out of their cell phones. They started with a box, and it was very expensive, and it was a one-time thing. So it was, in the early stage it worked, but they got their early adopters of families that really wanted to put their phones away. So it was a nice, small business test. They had like a lot of customers actually, but they started to see so hard to scale this because customer acquisition is super expensive. When you're online business and you don't have recurring revenue, you just have to keep spending the money from, just investing in ads. The manufacturing is very expensive. So they started to think like, how can we evolve our model? They ended up going into software, and now they're selling to companies that want to do screen-free challenges. They're seeing a lot of success with certain pockets of customers. For example, like in the Christian community, they have a huge community that are off screens, and they use their app. So they're like, they really are evolving their business to a more recurrent revenue with different like segments. And that's been great to see their evolution from a harder business that lost money to one that really works for them. Finally, another example would be Keg. I really like this example. They are, they took one technology that already existed and brought it to be used in your own house with a wearable. And it's a fertility tracker. You just introduce it in your vagina, and you can very quickly measure if your cervical fluid is fertile through an impedance. And in the beginning, they started selling the product. So again, that's a one-time purchase. You have to be looking for your customers. It's very expensive, Instagram ads. But they had like a very nice community of early adopters that were super engaged, and and they were okay. The product wasn't great in the beginning because they really wanted the product. They were looking for this for a long time. But as they grew and they evolved, now they have new opportunities that are, with the data that they've been collecting, and also with they're launching a new app. They're launching like a new, they're going through FDA approvals to increase their market and make more claims. So now it's more interesting because they can have, like, on the one hand, B2B partnerships, which gives them some revenue, and they can have recurrent revenue. So this is another example of how companies evolve. In the beginning, you have to survive. So you maybe have a small market, and you are selling to really the groupies of your brand that really loves you, and they're okay if your product doesn't work so well. And as you're getting more mainstream, you have to really like have your stuff together and be better. And also you can, move into better business models. So again, like, something that is very important is a lot of testing. Product, position, price is the key. And again, is constantly testing. Your early adopters are very smart, so they're gonna find out after a lot of research about you, and they will choose between you and all the options, right? You have to always be thinking like, what am I doing and how is that better from all the other options? Even if you have a unique product, the options is either doing nothing or doing something very rudimentary, or, so you have to be thinking about how your solution is superior and is worth paying for. So you have to really understand their mindsets, who they are, exactly who they are, what problem and needs they have, what emotions they have around the problem, what are all the other options to choose from, and how much money they're willing to spend. And ideally, you maximize the amount of money that they're willing to spend. I see a lot of early stage companies not charging enough. That's a very common problem that we see. And I think you shouldn't be afraid to charge a lot in the early stages, because if you're really solving a deep problem, people will want to pay for it. And then finally, as a general rule, don't give things for free. That's not going to help. I mean, of course, sometimes you have to do, some pilots or something like that. But if you have something valuable, like, people have to pay. And also you avoid believing that you have revenue that is not real, that is real. So a lot of founders think, hey, look, I have like, I don't know, 50K a month. And then when you dig into the numbers and you do a little bit of diligence, you see that it was a hugely discounted pilot, or that you gave a lot of discounts. And that's very dangerous, because, then your product is not rightly priced and you don't have the right business model. So again, do a lot of research on pricing, business models, and before building anything, do all these things. There's so many resources now that are free, and Typeform, Google Forms, Reddit, Facebook groups, Google Trends. I mean, there's all these tools that are free today, and don't even like quit your job or leave your main source of revenue personally until you do all this. And this is just, finally, I want to talk about this because a lot of founders always believe that they have to do everything, and we are not good at everything, right? Depending on who you are, you might be very good at being a visionary, but then the visionaries are very dangerous because in the early stage, they might spend a lot of money, or they need a dream crusher. So surround yourself with all the skills and, strengths that you are missing. It doesn't have to be necessarily with talent. I think like keep the team as small as possible and as lean as possible, but maybe is some advisors or some investors or some, friends and family that are very smart and they want to help you succeed. And when you look at this table, like you have on the left more like the creative, non-linear thinking, and here is the more tactical thinking. I think they're all important to create a very good business. Of course, the more tactical stuff now is more and more done by AI. So that's great because you get a lot of like free talent now thanks to AI. But if you like look at yourself, what are your strengths? And if you're like somebody very visionary and very creative, look for somebody that is going to keep you in check, and somebody that maybe you're terrible at business model and finding ways to make money. That's okay. You know, just find somebody that is really good at find some good business people. I know it sounds like very, you know, not very something that is very abstract, but actually it's a skill. So just surround yourself with, you know, people that are very good at strategy and business, and the more tactical people and people that are like doers and get things done. So this is just a reminder that it's not only about the business model, but it's a lot about complementing your strengths as a founder. And some final thoughts, just a summary of what we discussed before. Prioritize sustainability over growth in the beginning, pick a good business model, and it's more than a science, so don't try to engineer things, because sometimes it's just a matter of, you know, making mistakes and iterating. That's why I always recommend people to not fundraise in the beginning, because you're going to make a lot of mistakes and you don't want to make them when the clock is ticking, because you already fundraised money and they're waiting for results. Focus on good business fundamentals, good gross margins, EBITDA, LTV CAC. A winning go-to-market and business model are all about product position price and testing those over and over. If you have to work really hard convincing people and you're early adopter, that means you don't have a good product, or you don't have good pricing, or you're not targeting the right customer. Don't reinvent the wheel. Simpler business models that make you more money are better. Look for win-win. You make a lot of money and your customers like your product. And if you don't have that, keep iterating until you really nail that. Finally, some industries and business models are just very hard. So do your research before you jump in, and look for other founders in the space that maybe created a company and failed, or other advisors or investors in the space, or just somebody that gives you the quick download of, just tell me all the things I don't know about my industry, because, you know, I don't know it all. You cannot find it by asking ChatGPT, right? So just do your research, and before jumping in, get all those truths. So I don't know, anybody has any questions or any specific? I mean, I talk about a lot of generalities, but if somebody has a specific questions, I like those.
Maria, yeah, first of all, thank you. And yes, let's open up questions. We still have another, whatever, 20 minutes or so, 10 minutes or so, whatever works. I know people get tired of this hour, but let's roll out some questions. Haranath, did you have a question? I saw your hand up for a second. You had an earlier question. Did you have something?
Yes, I do have a question, but I forgot what it was. I really, really liked what you were presenting. In your portfolio, when you invest in somebody, what usually happens? Do you take like a leadership role in the company, or you don't touch that? Or like, I'm a technology person, and a lot of stuff that you said just reinforced my understanding that I do not know much about the business side. I can innovate, but we need help. So
Yeah.
is that where your portfolio, you and your partner get in, or that's outside of your?
Yeah, I mean, we have our day-to-day jobs, and we're not going to run anybody's company. We are more like business partners. We put the capital, and also we work in different capacities. Like in the beginning, we generally start investing a smaller amount, so we don't take any control or any board seats or whatever, right? We always like to start like a smaller way, like working together, investing just a little bit. I mean, there's different situations, but that's for the most part like how we start, with a smaller check. I think once we see, okay, we are the right capital, because sometimes we cannot help. if somebody is like building like this is an extreme example because we don't invest in biotech, but somebody's investing in needs help to build a marketplace or a biotech company, whatever. It's like, yeah, we were working together in the beginning, but we're not the best capital to bring you to the next level. So we either help find who is that capital partner, or if we are the right partners, because your company is capital efficient, you don't need a lot of capital. I mean, our funds are limited, right? We are a small fund, so we can put up to $2 million per company. So then if it's a good fit, then we would end up working together and getting more involved and getting a board seat. But we generally would surround you with people in our network that are really good, that we trust, either as in advisory manner, or some people that if you need somebody to help you full time, we sometimes just like to introduce to certain people, But at the end of the day, it's hands off. It's not like private equity. When I was working in private equity, is something like very hands on. Like you get in, you have majority of the business, you are doing a lot. But we are a little bit more hands off, meaning that we give a lot of support, but at the end of the day, we're minority owners, so we cannot be involved in every single company. But yeah, we have a lot of support, and we have like depending on the company, it's so personal. Like we have to go in and really see what are you missing, what is your strength, and then what are you missing, and what do you need to succeed, and then we work from there. It's like very customized.
Maria, thank you. I got a couple of questions in the chat, so let me hit you with those, and then I will jump up to Andrew up there and the others. And I'm out of order, but there's some context here. What is the typical range of your investment that you invest in? And give us something like how many a year, or roughly how many companies, total you've invested. I know you showed some examples. I don't, so if you could explain that to people, because the alignment, I'm very active in this space, and the alignment of and you made this point, the alignment of a company to the potential source of the investment is very key from the founder's perspective, because you all have a limited time, money, and you need to be efficient in that operation. So
Yeah.
Can you explain a little bit just for your company specifically?
Yeah, we are very specific. We have a very niche strategy. That's why I take a lot of the things I say with a grain of salt. I think like most venture capital firms are looking to invest in the next unicorn. We're looking to create a lot more companies that are sustainable and that are going to be 50 to 100 million in enterprise value, but less zeros, right? So our checks, our total allocation per company is up to $2 million. We also have other co-investors that we like to invest with. So it wouldn't be just our capital. We like to bring a lot of people that are really experts in different fields, and they are also angel investors. Some of them might be exited founders in our portfolio or not, that like to work with us. So again, depending on the company, we would call different capital to co-invest with us, or bring different expertise. But in terms of our check size, is up to 2 in total. We wouldn't start with 2 right away. We normally like to see, hey, do we get along? Are we, working well together? And are we the next capital, the right capital to bring you to the next level?
And when
yeah.
how many like a year typically? I know there's not a hard number, but just kind of,
It has varied a lot.
How selective you are.
Yeah, we have a bunch of portfolio companies. We have around 70. Many of them are exited, but we would do in a normal year, like I would say 5 deals. Before it was more, we would do more quantity. But I would say around 5. Now we're more concentrated, and we're looking for more companies. I think like right now it's a hard and weird landscape, that funds have money, but it's just weird. It's a weird environment right now.
Yeah.
But yeah, no, we're actively deploying and really looking for companies.
So I just want to make a couple because I'm a new fund. I usually in the San Diego Angel Conference. I've invested with Interlock Capital. These are all people here in town, and I invest directly. And just for people who are like looking for capital, I keep bringing this idea of finding sort of the right sources to raise capital. And a lot of times because you go out and you talk to angel investors, there's a traditional way they think. I don't operate in that mode. And Marie, it sounds like you don't either necessarily. I operate in the worlds of single, double, triples, meaning I'm not looking for the grand slam. It could happen, lightning does strike once in a while. But the IPO market is a slim to nil. Okay.
Yeah, there's nothing going on right now.
And the future really is in direct listings, acquisitions, mergers, and the secondary marketplace. For many of you who are on this call, that's not just my opinion. That's where the market's going.
Yeah.
And so structure is going to be really important for you in terms of how the deals are structured. And don't forget, you could do debt. All right.
Totally. Yeah.
And debt is really attractive. Anyone who's making products, who has sustained sort of customers, cash flow coming in. I do debt deals all the time. And there's a place between lenders, like when they think of debt, they think of banks. Banks are usually, most of you, it's unlikely that you'll be able to lend unless you can secure it against something or you have an existing business. But there's this whole other marketplace that you might want to think about as you're raising capital. And there are times it isn't just one or the other. You can do debt, you can do equity, you can do a variety of ways to go. So you need to, as a founder, my only point here is in this marketplace, and I think in the future, continuous, you need to be creative as you raise capital. So I'm gonna go to some of the questions here too. We had some additional ones. It says, no, we answered that one, sorry. Oh, my question was, how and where do we find early adopters? And are they consumers or investors? That's Ivy Song asked that question.
Yeah, so I mean, it depends on your company. I feel like a lot of our founders, they are really close to the problem, like meaning they directly suffer the problem. So they already have even like a community of people that they naturally go to, like for example, like the example of Keg, the founder that couldn't get pregnant, and they have a huge community online talking about those things. It's like the people that are on Reddit, like talking about certain like very niche things. And you say, hey, I created this product. And, it depends on your company. Like for Cooler Heads, she's a cancer patient and cancer survivor. So she already has like a huge community around that. So I think it's always easier when you are the right person to start that company, because you already have an edge into having a big network around that problem. But if not, you just have to create that and find who are those people, or maybe you need a co-founder that has that network, because acquiring customers is just so expensive. You're gonna have to spend a lot of money.
Yeah, I agree with you. I think there are some like consumer products, for example, and I don't know if anybody has a consumer product where the consumer can become the investor. And I'll give just a quick example. I invest also on platforms, on equity crowdfunding and debt funding platforms quite regularly. And so 4 or 5 years ago, I invested in a company called Sensate. Why? Because it's just a tool that makes you relax. I thought it was a great consumer product. I first looked at it as a consumer product, and then I invested in it, and they ended up with thousands of investors. All right. Yeah. It's a different model. And some of you may ultimately use equity or debt crowdfunding to raise your capital. It's a different model than probably what Maria generally does from what you've described. And clearly most of the angel fund people, early stage investors, don't do that. Some of them blend now, where they'll do some equity crowdfunding. So customers, can be investors, but don't assume a customer is an investor. That's a nightmare. All right.
Yeah.
You have to be very sensitive about that.
Yeah, you have to be careful because you see a lot of those, a lot of founders trying to take advantage of customers, you know, that they don't understand investing and they put a crazy valuation or bad terms. So yeah, I don't like when I see that. It feels like really wrong, but yeah, there's a lot of like companies, even in our portfolio, that did that, and they were very successful with it, even with, you know, Kickstarter and things like that. And that was a good way to start too.
Yeah, that works. In fact, there's a company, I helped them in the beginning, but I'm not involved now, but there's a bakery well known here called Zola in town. And I was very involved with the founders in the early stage, and it's not a company I would invest in typically. In fact, I didn't. But I did help them go through the process, but they have aggressively pursued their consumers. And it gets difficult after a while because they're buying your product and then you're asking them for money all the time. So, you know, it may be fresh year one, but by the time you get to year three, it becomes more challenging. So my point of this is think about capital raising and capital period as a strategic relationship that you're going to have with people. It's rarely a one-off type relationship. So let me jump in the questions here. I've got another one. When I present my business model that is both simple and highly scalable, some investors react with skepticism, particularly regarding the scale and growth projections, especially when reviewing my financial model. From your experience, what specific aspects of the financial model tend to raise the most concerns, and what type of data or validation would make these projections more credible? Is this information in the financial model? That's a long, long question with.
Yeah, no, it's a great question. I feel like financial models for startups are like, you know, it's nice to have it, to have something, but I never seen something that even like gets close to reality, right? Looking in retrospect. So I think, again, I think it's a good exercise to understand your business and plan for the future. I think you can test a lot of assumptions, you know, doing surveys, you can test, or even like trying to figure out what's your market size. There's a lot of work you can do. Yes, everyone is skeptical with the growth in the models because they never work like that, right? I've seen maybe twice that, you know, a founder was very conservative and actually hit their numbers. But I think you can do a lot of testing, and then it's just a question of like, where do you want to spend your time? Fundraising or finding revenue, you know? So of course, not everyone can go straight into revenue because you need money to start. But I think, you know, raising pre-seed now is so hard that I would just go and try to find a customer, even if you have to, you know, I've met like some people like recently that they're even doing medical device and they're just going first to the strategics and saying, hey, if I build this and I spend this much, will you buy it? You know, and they say, yes, that's very good for our portfolio. So I think just find a customer first and spend more time on the revenue side than just fundraising, because it's such a waste of time to go fundraising. I think it's better to just have everything ready, and the last thing that you need is the capital, because the capital will come. If you have something really good, even if it's still early, I think it will be easier to fundraise than just having a lot of like, you know, a perfect pitch deck and a model that it's very theoretical.
Yeah, I mean, clearly early stage investors, you know, we're talking about pre-seed particularly, they love to see customers, okay? As long as they're the right kind of customers, you know, and that's, you know, you get into the whole discussion, the right ones. And I'm gonna let Andrew, I know you had to run, so go ahead, ask your question. Sorry, I didn't catch you.
All good. Thank you. Maria, that was a great talk. That was very informative. Thank you. I kind of have a question for both you and Bobby. Kind of wanting to get the VC versus an angel investor's perspective on, right, when you say like get a customer or you're going through the customer discovery phase, how beneficial is it to get like an LOI versus like we did a survey and this is the general trend of the answers that we got from talking to our customers and getting their feedback? Like, how does that influence your decision and whether or not you're investing or not investing?
I mean, LOIs are great, you know, and I think it depends on the investors. Like there's some early stage capital in pre-seed, and you know, the more data to demonstrate that people want this, the better. So LOIs are great. Maybe you are coming from an industry that you have a huge insight in the industry and you're an expert in the industry and you know they're missing this. And then the minute I build it, I will be able to sell it. I know they're missing this product, right? So I think LOIs are great, surveys are great. And having like a customer that is like, okay, I'm not gonna pay you before because you know you have to build it, but I'm very interested in this product. And maybe you can even have like you know, some partnerships in the beginning. There's like a company in town that the founder is incredible. She already exited her company, but in the biotech space, Reveal Biosciences. And it's a very, you know, she's in a very capital efficient, intensive industry, but she managed to do a lot of partnerships early on and do research with some different customers. So she could fund the company in the very beginning before even thinking about fundraising. So you would think like there's a lot of industries that are very capital intensive, but I think there's always a way to make money. If you're providing something valuable, even if you have to change the business model over time, like a lot of our companies, you can always find a way to make money. And maybe it's even consulting in the beginning where you make a little bit of money and then really understand the problems. And when you're ready, you jump in and you get into the entrepreneurial side. So again, I think for the most part, I would just spend more time building that interest instead of just talking to investors and fundraising because they don't know. I mean, they are not customers, you know, they might give you money, but then you're gonna waste it because you have to go and build it and it will be wrong anyway. So just spend all that time just working on the revenue side.
Yeah, Andrew, I would just add just a couple of things. One is LOIs are better than no LOIs, but no, like anything, like no order, no LOI is the same. So, you know, when you get into like, for example, and I'm going to apply this to SDAC because most of you are going to be going into SDAC or many of you. If you make it to where they start doing deep due diligences and you have an LOI, they're going to dive down the rabbit hole with you, okay, to ask a series of questions depending on the team that's involved. And they're going to say, you know, what does this LOI really mean? Can I talk to the people who signed the LOI? You know, I mean, that's the kind of deals that happen when people are getting close to giving you money, all right? So yes, and you'll get pressure, my guess. Very often you'll get pressure to take the next step. Like, how do you get an order? Okay, how do you ship something? Or how do you get things more firm than an LOI? Now, you can't always do that. So I'm not saying that always happens. But it's better than not having one. But it'll be questioned because LOIs, like I'll give you an example. In some industries, you can get an LOI that's even a commitment that says we'll buy X amount without a timetable, a price, you know, or anything essentially, and it's meaningless. But if you have something that's meaningful, you know, that you can point to, it's way better than having nothing. There are industries like in the life science field where you have even special commitments on we'll call it philanthropic money, okay? And I'll give you just a quick example. I helped a company recently go through the process of raising capital, and they would have gotten no money except we found out they got $20 million from the Gates Foundation. Now, and then we talked to the Gates Foundation. But on the surface, people say, well, it's going to take a long time for this to get. And then the Gates Foundation explained to you their money was important. So sometimes there's money and relationships that are really strategic that make a difference in at least from my perspective as an investor in being involved in them. So that's basically the deal there. Melissa, we're getting
Thank you,
I know,
guys.
a bit over time. Are you okay, Maria? Just spend a couple more minutes, or do you got to?
Yeah, a couple more. Yeah.
Okay, so I'm gonna let me just. Oh, I think we lost. We thought we had someone there, but I guess not.
Oh, I did. It was me.
Oh, you're there. Go for it.
I just took my hands
Sorry.
down.
Oh, sorry, Melissa. Go ahead. Sorry. Go. Yeah,
Thanks,
yeah.
Bobby. Thank you,
Good to see
Maria.
you.
I really appreciate all the information and encouragement. Sometimes it's a little bit discouraging, so I really appreciate it. The question that I want to ask you, I come I have an impact business. And so it's really important to me that the end users who I work with a sign language education, so it's a SaaS-based digital learning multi-platform delivery system to deliver high quality content for promoting learning of or through signed languages. And in the deaf community, a lot of deaf and hard of hearing children are not exposed to a sufficient amount of language when they're born. They get kind of shuffled around into audiology systems, medical systems. And so 70% of deaf and hard of hearing kids enter school severely language deprived. Like my son, who I adopted at the age of 5, knew 30 signs, for an example, and that's really typical. That's here in San Diego County. So, I've gotten into kind of like wars over that idea of, if you value your product, which I do, I know we've made an amazing product, but because I value the product and because I believe it can get language into homes of deaf and hard of hearing kids in a way that's non-threatening to families who are dealing with all of those struggles, it has to be a freemium model. Like, it has to be a freemium model. So I'm looking at revenue with B2B, with content development, with I have lots of other ideas.
Yeah, no, I think that's great. And again, I think that I talked about some generalities. I just get scared about the freemium model that they, it entails giving a lot, and but I like freemium model. I depends on the situation. Don't take that generalities. I think every situation is different. So your customer better if you know that there's a huge gap and resistance to pay and trust. I think freemium is great. Just offer like a basic something, and then if they really like it, offer another layer of more value. But that's all about customer discovery, like seeing like, okay, the people that are my early adopter, they're gonna try it and test it, they're gonna want more. What is that future that needs to be paid versus what is good enough for more people to adopt it? I think freemium is good. I was like thinking more about the very early stage, like sometimes people give too much for free, so I'm just trying to shy away from that. But if it's well designed, I think freemium is beautiful. It's good.
Okay, thank you. It's nice to have your validation.
You just have to do the testing,
Yeah, right. And figure out where you're going to get the revenue. If it's not going to be from these end users, then who is going to pay for it? So whether
exactly, I just get worried because it costs to have users using something for free, right? I mean, you have to pay for the servers, you have to pay for the developers, like all that stuff. So you don't want to give too much for free, but if you give enough for free, that then they go and pay. Just have to do all the testing and funnel and seeing, are you giving too much for free, or just enough that they can test it and then acquire the customer.
Maria, before you go in the hand, there's a great point there. A lot of people in early stage are getting a lot for free, okay, or their cost is so low in terms of using data, but many of these are platforms or have some element of platforms. And we always talk about, one of the things we talk a lot about is the economic model, the assumptions that you're using. And when we look at the assumptions, like as you scale, guess what? You begin to incur those costs, all right? And so forward looking, like if your model, for instance, you get people say, I'm going to charge $9.95 a month. I mean, that's just an arbitrary, model of SaaS that doesn't make sense always for what you're doing, for the value you're providing and or the cost you incurred. So when you go through the process, again, SDAC, I'm going to keep referring a little back to SDAC. There should be, if you want to improve your position, study the assumptions. Okay, you can find an analog very often, a company that's in business that is, that you can look at the analog or talk to an advisor or talk to some other experts in the field and realize that it's not going to be free. Okay. And there are, and I will say there are ways that get creative. I have friends for 4 years that get free services for a year, literally for like $100,000 plus $200,000 worth of service. But most people at some point are going to have to pay for that. All right. And if you don't have that built-in model, then nobody's going to take the investment. Haraneth, you had a question there. Go ahead.
before I go with my question, I want to applaud what Melissa is doing. It is a truly under recognized ailment, what deafness, not being able to communicate with others, being removed from the social network. It's absolutely important. And thank you, Melissa. This is a very big problem.
Mhm.
And the business side, all of those things, I don't understand. I see the same thing from you, and that's why I'm here. My question was actually something that you mentioned, Bobby, before we got to Melissa. I wanted to follow up on that, and I lost my track of thinking when I was listening to Melissa's story. You were explaining something about somebody else's question, and you and Maria were going back and
Well,
forth.
let me just, by the way, I'm going to make a suggestion for you, okay? Is as a, one of the things you're going to experience, and I tell this to is write it down. However you do it. And I say that half,
I keep writing it down.
I say half jokingly, but the truth is, like, if we were in a room right now and you were in a room of investors and we were talking to you, things are going to fly like a mile a minute. All right. And we don't, by the way, investors, like people in early stage investors, like most of us, we're not searching for perfection. All right. It isn't like because we don't live in the world. We live in the world of grays, lots of gray. Okay. And so, but I would suggest, you know, if you got into it, people want to build, what you have to do is build trust with the community, the ecosystem, the individual investors. And I would say to anyone on this call, it's not the magic of raising capital like this minute. Okay. Like if you tell me today you need 250,000 or 500,000, $1 million, you need it next week, I'd say, we'd help you. I mean, I'd always help you. But the chance of that happening isn't how it works. If you just suddenly landed, like you landed from Mars and you landed here, it just doesn't work. The system doesn't work that way for most people, okay? Maybe you cured cancer and you're going to get the money, but generally that doesn't happen. So, I just keep notes there. You've got a question, Chris. I noticed you got a question there. And guys, I'm going to give it like 5 more minutes and then it's time to have dinner, at least for me. I don't know about you guys, but I'm happy, email, I'll put my email in too. And Maria, if you want to put, I don't know if we'll,
Yeah,
we
sure.
already had it on the display, but if you want to put it in there.
Yeah.
So Chris, go ahead. You got a question.
Yeah, I just had a quick question, and maybe I missed this regarding just not too long ago, you talked about partnerships, that you have a founder that had built partnerships before actually like going like making her business more public. So can you give more intel on like what that means and how those relationships were created and agreements?
Yeah, this particular example is not in our portfolio. I just happen to know the founder. We do have a couple in our portfolio that did something similar, but I think the example would be, there's a big company that is doing some research in this space, and you are maybe working a biotech company, and instead of like going and having to create like all the, the approvals or whatever, maybe you do a partnership saying, I have a lot of knowledge on this. Can we do some work? Maybe it's contract work or maybe some partnership. Maybe you're selling them like some specific service, and you work, you get some revenue while you're working towards your big goal. Particularly, I don't remember what was the company, to be honest. Like, I know that some of our companies did some work for Illumina in the past. That was before I joined with, Alison would know more about this. But it was a company that in particular is more capital intensive, but while they were getting there, they were just doing early work to get some cash flow to keep funding their business.
Mm-hmm.
So they can look like many different ways. They can be like selling them some services as contractor in some research. A lot of these companies, they just have so much budget to spend that you just have to find where is their budget, how much I can, get of that budget before, having to go through, bigger approvals and see how I can add value to them and see who is the decider, because sometimes there's different levels of approvals for different budgets, and they have a budget for contractors or for some, getting some different services that you can take advantage of and sell it to them.
Okay. And then you just make like a contract with them based off
Yeah.
of that. Yeah. Okay. Thank you.
All right, there any, I think we may have answered, any other questions before we roll out of here? All right, well, first of all, thank you for everybody who's attended. This is a long evening. I don't know about you guys, but I know for founders, it's usually a long day. And I hope it was worth your time. I know there's another session in a week or so, and you guys have it probably on the calendar. I'm sorry, I don't have it in front of me. I put my email in there if you've got some additional questions. I'm happy to answer via email, and or if you're a client at the brink already with an advisor, feel free to ask your advisor or send me a note. I'm happy to meet with you if it makes any sense. And thank you, Maria, for spending the time. It's much appreciated.
Thank you. Thank you for having me. Bye.
Okay, guys. Good night.
Thanks, everyone.
Take care. Bye-bye.